I'm Claudine Wong, joining you from KTVU in the San Francisco Bay Area, and I'm joined by Dr. Bhargava, who's a pediatrician and a WebMD Senior Medical Director with lots to talk about. Thanks for joining us.
Thanks for having me on,
Yes,
Claudine.
always good to get your insight. And let's talk about schools first, because that's been the big news as schools are trying to reopen. And in California, there's of course a plan, but it's not, it's so flexible, which I think makes it difficult for the parents of children to say, okay, what is our school district going to do? How is that going to compare to other school districts? And will that all feel safe?
Yeah, I think it's a really hard nut to crack for sure. And on one hand, parents do want their kids to be back at school. There's parents who work, they have to go to jobs. And so what do we do? Is it online? Is it in the classroom? But I think the main theme, Claudine, is that we need to make sure the kids are safe, the staff are safe. And so I think it's not going to be school like it used to be.
Is there a way, and I guess the problem is too, I think when all this started in March and everyone left school, they were hoping that by June, by July, we'd have some more clarity about what this virus does, who's most at risk, how do we prevent it? But it has gone back and forth, right? You know, the WHO just said, okay, asymptomatic people may not be as contagious as we think, but the CDC isn't saying that, or the coronavirus task force with the White House isn't saying that. And so as we get closer to August, you got to wonder, is it going to be even more muddled by that point? And it puts really, I think, school districts in a tough spot to how to ensure that. And I would assume like the families are coming to their pediatricians going, what should I do? Especially if their child has asthma or anything that may put them at a risk.
So I think you bring up a really good point there, Claudine. One is that it is a moving target. I think health authorities are fluctuating, not because they want to, but because it is a moving target. Every day the information is different. And certainly different authorities interpret the data differently. So you brought up asymptomatic people not necessarily being as contagious, but the question is it asymptomatic or is it pre-symptomatic? Is it before symptoms start? Or is it the fact that they have the virus and they're not exhibiting any symptoms? So, and that's not distinguished very well. So the point being that, hey, the data is just not very clear. So it's very, very hard to make those kind of rules around that. Could there be a second wave? Sure, there could be a second wave. We know that. Could it get worse? Sure. Could it get better? Sure. Like, unfortunately, I wish, I know that's all muddled, but the honest truth is that it's very, very hard to tell. But one thing is clear, and that is that, parents will have to be advocates for their kids like they always are. And that includes the safety, but also the education of their children. And I think that if your kids are at risk, are they immunocompromised? Do they have cancer? Are they on do they have chronic diseases that could put them at risk? Then yeah, I think you need to advocate and make sure that they are protected and are safe. If you are lucky and you don't have kids that have those issues, then basically it's common sense practice. So basically everything that you're doing right now, when you go to the grocery store, the precautions that you take, I think it's a really good idea to take those precautions, even if your kids go back to school, and to ask the schools the right questions. How will you social distance? How will I make sure that, a sick kid is not close to my child? Or do I need to keep my child at home if he has any symptoms? So we kind of all have to work together to make sure that it's safe for all our children, all of our children, not just my child, but everyone.
And every grandparent they may have at their home, or everyone, because even the kids don't get sick if they are bringing anything home to more vulnerable members of their household. That's also a thing. What's interesting is that I just was thinking the other day that a lot of parents I know have been keeping their children at home during the shelter in place orders, right? It's the mom or the dad who are going to the store and have had to get used to the masks and have, are very aware because they've been out trying to live life. For the rest of the family, they've been staying inside. And so now as kids are being allowed to go on a bike ride, maybe with their friends, or they're seeing more people, they're not in that, maybe in those habits as well. And so learning those habits over the summer might not be a bad idea too, because when they go into a classroom, kids normally feel a little bit invincible anyway, and have to be reminded just on a daily basis, right? Brush your teeth, wash your hands. That these, for them to be able to be good members in their school, we should be practicing right now.
I agree with you. I think this is a great opportunity for families and parents and grandparents to reinforce the messages all through the summer. And kids will not listen. I'll tell you, even with my own kids,
Yes.
if I tell them once, it kind of just flies in one ear and out the other.
Yes.
But if you deliver those messages often and you practice what you preach, that's really important. So you walk in from the grocery store and you go straight to the sink, wash your hands for 20 seconds. And you even say, hey, I got to go wash my hands first before I give you a snack. You know, those are things that kind of get embedded. So basic practices that we talked about during flu season, Claudine, are just even more important now. So hand washing, not sharing drinks or food, staying home when you're sick, and getting vaccinations, which is something that I spoke to Alex about last time. You know,
Yes,
it's really important to make sure your kids are vaccinated now more than ever, because there are some areas of the country that have drifted downwards for vaccinations. And, you know, that means everyone's at risk. And there are diseases that are even more contagious than COVID-19.
Right. And that we know we can stop, right? We keep waiting for this vaccine for COVID-19, but we are not. We should make sure we take advantage of the vaccines that have already been found that can also prevent those very terrible diseases that we know that we can keep from having outbreaks, and measles, mumps, rubella, all of these things that we know are bad, and whooping cough.
Yeah, why wouldn't you use what you already have in the toolbox? You already have it, like use it. Yeah, absolutely.
Although I wonder, do you think, because this is what I was talking to another parent about the other day, was saying, okay, let's say they find this vaccine and it's faster than normal, and, you know, and it works. But, you know, we have polls that say 50% of Americans don't want to take the vaccine. Maybe they're nervous about the timeline that's so fast. They're not sure about side effects. You know, a lot of these shots are required for kids to go back to school. Is there talk within the medical community of, will they require, you know, the flu vaccine is not required. It's recommended. They say, you know, you should get it, but it's not in that other list of, you know, DTaP and all these other ones that they have to show that they've gotten. Where does COVID vaccine, if it gets developed, in the big if, fall in line with schools?
Yeah, I mean, I would say informally, healthcare professionals have been talking about that. It is too early, probably, because the COVID vaccine is not out. But generally speaking, I think that's going to be up to all of us as a society, if there is an effective vaccine, to understand the importance of it. And just like with other vaccines, look, you know, if we want to protect ourselves and protect others, it's just a matter of the we. I was talking to a good friend of mine who's a surgeon, and, you know, we talked about this. We talked about how healthcare is really about the we. It's not really about the I. It's like you protect others, then you protect yourself. So even the mask, for example, when you wear a mask, you're protecting others. And so people may say, well, why do I have to wear it? I'm fine. But the point is that if somebody else is sick and they don't wear it, then you're going to get infected. So we kind of have to all hold hands and do this together and make sure everyone is protected.
And we don't operate in our own bubbles. I hear the comparison to secondhand smoke, right? It's not just you choosing to smoke. It is if you're doing that in a certain place, then you take away someone else's choice as well. And it's not that community, we're in this together kind of situation. Let's talk about the other thing that's come up as we all try to learn about how to best protect ourselves. There's been a lot of discussion, right? And I think when you go to the grocery store, what should I touch? What should I touch? Do I have to wipe everything down when I go home? And I've gone back and forth. I went from not wiping everything down to wiping everything down, and then coming home and being like, I can't today. I think it's probably fine, you know, because you're trying to be good, but it's exhausting to try to think
absolutely sure
about it. But I mean, there are some things that we know to be true. And I think when it comes to bleach, like I walked down the aisle the other day at the cleaning aisle, because I always just walk down it to see if there's anything available. And the one thing that is available more than the other stuff is bleach. And I think that's maybe why it's now being used for things it shouldn't be used for.
Yeah, I think you said it correctly. Like, look, we're all trying to do our part. We're all trying to do prevention, but we just have to be really careful to stick to the facts. And the facts are that bleach is not necessarily, it just isn't something you want to use on your body. And the CDC basically did a survey because there was a spike in poisonings and injuries from bleach, just wondering what's going on out there. And they looked at, they questioned over 500 adults, and 39% of them, like almost 40%, were using bleach and other such cleansers inappropriately. So that includes putting it on your skin, putting it in your mouth, ingesting it, putting it on fruits or vegetables, that is really bad stuff for the human body. It's not
Yeah.
meant for the human body. So I think it's just really important to stick to the facts, to talk to your doctors and nurses, to look at sites like cdc.gov, WebMD has one, but other health sites that give you factual science-based information and not just running away with some, if your, your neighbor said something, work. No, no, stick to the authorities and to the facts.
Yep, and even bloggers or any people who are not citing sources that we know to be credible. And it probably goes to say too, if you, the back of Bleach, it says put on gloves when you're using that. And the warnings are there. I think people forget that the warnings have to be there because of the testing, because of things that have gone.
Yes.
This is not just Clorox saying, hey, let's just put that on the back. It's because they are required to by law, because it is dangerous if it comes in contact with your skin, if it comes in, you're not supposed to ingest it and all those things. It's read the back.
They are serious agents. They are serious agents, and they can, just like they can break down bacteria and viruses, they can break down the insides of you. So just, you got to be really, really careful. And I think, using the wipes with the alcohol on surfaces is totally fine. And, if you want to use bleach and you want to dilute it to clean surfaces, that's fine. But really, if you are about to put something in your mouth, like a strawberry, or you want to clean out your mouth, stick to the things that will not harm you. And of course, the secondary consequences, Claudine, are if there's kids around and there's bleach outside or toxic substances and they see you using it, or they may just see you and get curious about it because that's what kids do, that can lead to really bad incidents that can cause serious harm and injury. So just be really careful, put them in locked cabinets, especially with young kids around, and just know your facts about the uses and make sure you don't use them unsafely.
Not every product is useful in all those different situations. I know I bought a cleaning agent that I hadn't ever used before because it was only, I have brands and different things that I've used in the past. And it was actually the cashier at the grocery store. She's like, this is supposed to go on like stuff, but don't put it on your kitchen counter. And I'm like, really? And she's like, yeah, this stuff is crazy strong. And then she pulled out, she goes, but how about this one? This one's better. And she traded it for me, which I was like, thank you, because you're using and there's not as many things that you find that you normally used or purposes that you normally did it for. And so do you feel like in the conversations that people are having with their pediatricians that we're getting better at asking questions, or are we getting worse? It's hard to know in this pandemic.
Yeah.
Because it's a moving target.
You know what? I think that the questions are being asked, and I really appreciate that. And look, all of us are human. I mean, we, when we're fearful and we're concerned, and we just want to do whatever we can to prevent. So, there's no blame. It's just a matter of just remembering that generally facts don't change, science doesn't change that much, and just make sure you do what you always do, and that's read the instructions, talk to the doctors and nurses, and make sure that you kind of follow that, not social media necessarily.
I know. Yeah, no, great advice. There are a lot of moving targets, COVID-19 being one of them, but there are a lot of things that are kind of rock solid and things that we know set in stone, and we need to make sure that we also lean on those things to guide us through this very uncertain time. Dr. Bhargava, pediatrician and WebMD Senior Medical Director, great to talk to you. Great advice as always, and we appreciate your time.
Great to talk to you, Claudine. Thank you.
And for more interviews, you can, of course, go to coronavirusnow.com. Thanks so much for joining us.